things that
So let's talk about something different. And I think this is pronounced as
cholecystitis.
cholecystitis. How do I say that?
Cholecystitis. Sure. That.
Cholecystitis,
Cholecystitis.
cholecystitis, whatever.
Whatever.
Close enough.
Yeah.
I only know the pronunciation because my father had to have his gallbladder removed. So
Okay, so this is one of the diseases that affects older adults. And middle-aged folks have higher risk for acute cholecystitis. I don't know how to say that. And old-age adults have higher risk for chronic cholecystitis. I don't know how to say that. Okay. So here are the risk factors for these cholecystitis. Okay. It seems that for females, the risk sometimes work through hormonal contraception or hormone replacement therapy. And sometimes pregnancy can also increase the woman's risk for cholecystitis. And with the use of hormonal contraception, hormone replacement therapy, and pregnancy, these can increase a person's risk for gallstone formation or cholesterol stone formation. And sometimes taking certain drugs, like the use of carbohydrate drugs to lower a person's cholesterol, can also increase gallstone formation and increase the risk of this disease I cannot pronounce. And having a high calorie or high cholesterol diet, sometimes certain diseases, illnesses may develop because of this diet. And the person may use this kind of drug. This can increase the risk for gallstone formation, regardless of whether the person with high cholesterol, high calorie diet use these carbohydrate drugs or not. So the arrow can go here and then here, or just straight to here. And the person's diet depends on the person's residence, right? We've been through many times. The person's neighborhood depends on what's available in that neighborhood. Whether the person have transportation, public transportation, or his or her own transportation in those neighborhoods. Whether there's healthy food stalls or just a bunch of bigger stores, convenience store, grocery stores that sell chips, fast food, restaurant chains in those neighborhoods. There's no health food stores in those neighborhoods. And these can determine the person's diet, especially if transportation system in that neighborhood is not trustworthy, very ineffective. And crime rate is high. People don't take public transportation. They don't feel safe. High unemployment rate. So they just make do with whatever that's available in those neighborhoods. Those convenience stores, those liquor stores, maybe canned food, all kinds of fast food, junk food available in those stores. This can contribute to high cholesterol, high calorie diet. And depends on the income of the people in those neighborhoods or the education level of the folks living in those neighborhoods. They may or may not know that this kind of drug, this low fibrate drug, can reduce cholesterol level. Not everybody is aware of that. And my point is, I think social science and biological science, they exist in tandem. We need to focus on both. Whether we are social scientists or health scientists or biologists, it doesn't matter. Your education level determines where you're going to live. Your income determines where you will live. It determines the job you're going to get, the type of insurance that goes with or without those jobs. It determines whether you are aware or can afford this drug. This ultimately affects a person's risk for gallstone formation. This is just intervening mechanisms. SES sometimes can affect the risk for gallstone formation through the use of certain drugs or through a person's diet. And sometimes these effects can be cumulative. The effects for cholecystitis or whatever. Because our diet can accumulate, we can have the same diet throughout our lifespan. If we don't change our job, our income stays almost the same. We live in a neighborhood the rest of our life. It can increase our risk for this cholecystitis or inflammation of gallbladder. This is easy. Just call it inflammation of gallbladder. At least I can pronounce it. And for those maybe 60 or 65 and older, the person's risk for chronic cholecystitis increase. And when somebody has this cholecystitis, it can also cause pus and fluid accumulation in the gallbladder. It can also cause distended gallbladder. It can cause gangrene, maybe a new disease, open a new cancer of worms, as we can see. It can increase of course, increase the risk of cause pancreatitis. It can cause bowel duct infection. Then it can also lead to chronic cholecystitis. It can open a few new cancer of worms. It can cause comorbidity when somebody has this. And when this progresses through time, it can cause all these things. And it may cause new diseases. Open new cancer of worms. It can cause all kinds of social implications. The person may have mental health issue, get more worried, more anxious because of new diseases develop, new comorbidities develop within the person. And not everybody, as you can see from this chart, has equal risk of developing gallbladder inflammation. It varies by education, income, residence, and other socio-economic factors. So this can also cause health disparities. As you can see, because it works through different factors like levels of calories and cholesterol, which varies according to education, income, wealth, neighborhood. And sometimes it's just the physical makeup physiology of different sexes. Females' risk may increase through hormonal contraception and hormone replacement therapy, and only people of biological female sex can get pregnant. So this can cause all kinds of health disparities. Question. Okay, let's go to another illness that affects the elderly. Now, let's look at diverticular disease. Or I think I mispronounced again.
That was good.
Huh?
That was good.
Okay. So, the risk factors for this diverticular disease is fatty diet, low fiber diet, substance use, especially cigarettes, aging. Sometimes the type of diet can continue from childhood years to old age. Because of that, aging is another factor that works through diet, among other things. Maybe some of you health science majors, biology majors, no more than me. Obesity has something to do with diet. And taking certain kinds of medication, like anti-inflammatory drugs, can also increase a person's risk for diverticular disease. And what determines a person's diet? Once again, where you live, we've been through this. What kind of store is available in those neighborhoods? What kind of transportation is available? Whether people can take the transportation, public or private, to other places to get healthy food, nutritious food. Or if it is too risky, nobody trusts the public transit system. So they continue with all this kind of diet, fatty diet, low fiber diet. It increases their risk for diverticular disease. And where we live depends on our income. Our income depends on our education. So once again, social science and health science and biological science, they exist in tandem, my 2 cents. They are inseparable, my 2 cents. And the risk of smoking and other substance use, who is more aware? It depends on the person's education, where they live, who their neighbors are, who they interact with, who they network with on a daily basis. Neighbors may tell them something about the dangers of substance use. Any question? Let's look at the third disease, peptic ulcer, that affects older adults. So, the risk of causal factors for peptic ulcers include blood type. This is somewhat innate in our system. It's somewhat beyond our control. Correct me if I'm wrong. Somebody with type A blood can have increased risk for gastric ulcers, and peptic ulcers may be a comorbidity with gastric ulcers. Gastric ulcers sometimes can coexist with peptic ulcers. And somebody with type O blood may have increased risk for duodenal ulcers, and these may coexist with peptic ulcers. This is more like factors beyond our control. It can also be due to genetic. I don't know if heredity plays a role. Maybe somebody is a carrier, he or she does not have it, but the cousins, the other offspring people from the subsequent generations have it. I'm sure you've seen the genetic chart or whatever you call it, how the disease is being passed across generations. Have you seen one of those? People from health science and biology? No? Okay. I've seen one of these in my pathophysiology class. I took it at UNFC for 2020. Okay, maybe I should be more prepared for class. I'm getting old. I'm prepared for other stuff. I forgot to check on this. The genetic charts. Yeah, I'm getting old. Okay. So the risk for peptic ulcers can also increase with irritants. Any food or medication we take that can upset the lining of our stomach. These irritants can include any food or drugs or medications that upset our stomach. And mental health factors, experience of trauma, anxiety, or stress can also increase a person's risk for peptic ulcers. Okay. Aging. Sometimes this may go on from infanthood until old age. So, aging as a person age across the lifespan, the person's risk for peptic ulcers can also increase. And having this Zollinger-Ellison syndrome can also be a comorbidity, or having this syndrome can also increase the risk for peptic ulcers. This syndrome is where the stomach is too acidic because of these gastrin hormones. I think. Am I right? Those from the health sciences or just anybody? I think my understanding of this Zollinger-Ellison syndrome is because of the presence of these gastrin hormones, it makes the stomach too acidic. It in turn increases the risk for peptic ulcers. And if the person is taking these non-steroidal anti-inflammatory drugs, it can also increase the person's risk for peptic ulcers. And having this H. pylori, a kind of bacterial infection, can also increase the person's risk for peptic ulcers. And whether the person is going to be aware that his or her blood type can affect his or her risk for peptic ulcers depends on what? The person's education or health literacy. Whether the person knows how to look up these peptic ulcers and may be linked to Mayo Clinic, CDC, other websites, legit websites, and learn something from it. It depends on the person's literacy and education. How the person is going to search on different search engines to look for info. If they suspect they have certain symptoms related to peptic ulcers. And education determines our income. Income determines whether we can afford internet or not. Maybe some people in certain neighborhoods, poor neighborhoods, run down, dilapidated neighborhoods, they cannot even afford internet subscription. They cannot even search. They don't even know how to search. If they barely got through elementary school. So once again, this example shows us that social, health, and biological science exist in conjunction. They are inseparable, my 2 cents. And a person's education determines a person's awareness of predisposing factors like irritants and genetic factors that may affect the risk for peptic ulcers. And our level of stress depends on our occupation. Level of stress, our mental health states also depends on our education or the neighborhood we live in. High crime, we don't feel safe, we are anxious all the time, we are stressed. So once again, social biological health science exists in tandem. We need to look at all these factors from different disciplines holistically. Can you see that? And sometimes these factors can accumulate over time. And because of that, as we age, the risk for peptic ulcer may increase over the life course. Some people may be more aware, depends on their education, neighborhood, who they mingle with, what they talk about on a daily basis with their neighbors. And income. Sometimes income determines our health coverage. Health coverage can buffer the risk for peptic ulcers through certain treatment programs, preventive mechanisms. And education determines our awareness of this Zollinger-Ellison syndrome that may increase the risk for peptic ulcer. Education increase a person's awareness that these two may coexist. Having a certain level of literacy or education may affect how the person search online when they suspect they have certain symptoms, and whether they are going to find out that these two may coexist. Depends on the keywords they use to search on Google, on Bing, and whatnot. Having a certain level of literacy or education determines whether a person is aware that this drug, these non-steroidal anti-inflammatory drugs, can affect the risk of peptic ulcer. And sometimes maybe a person's income level enables a person to take these drugs for other issues. A person has a pretty good job, certain level of income. They have to take this drug for other reasons. With their given education level, they may be more likely to be aware that taking this drug can increase their risk for peptic ulcers. And they may, if they are able to, if there is a way, take certain precautions how to circumvent this risk. They may ask their doctor to give them another drug. If they are PhD or have advanced degrees, they are aware. They are trained as scientists or whatnot. They are aware. They may ask their physician to change their prescription. They are more aware than the other folks who barely got through elementary school. They will accept any prescription the physician gives them. Even if somebody is trained in the humanities and is trained in the social science or the arts, if the person has a degree, college degree or graduate degree, I don't know if you've seen Mayo Clinic website, CDC website, and other legit website. When you Google these diseases, are they very technical or is easy to understand? Are they written in layman's terms or they are very technical when you go to Mayo Clinic? Have you been to Mayo Clinic website or CDC? Are they written in highly technical professional jargons or anybody can understand. If you have a high school education or a decent level of reading comprehension, you can understand, regardless of whether you went through high school or not. If you go to CDC, Mayo Clinic, to search for different diseases, is that easy to understand? You go figure out. So my point is, if the person has a certain literacy level, he or she can search, and when he or she goes to CDC or Mayo Clinic websites, I'm sure the person can understand that taking certain drugs or even this syndrome may coexist with these ulcers, and if the person has this infection, it can increase the person's risk for peptic ulcers. All these websites are written in layman's terms, in my opinion. So somebody with a high school education, humanities degree, arts degree, social science degree, I'm sure they can understand, okay? So this is another manifestation of social science coexisting with health and biological science.